Welcome to our Wellness Hub, where experts in the field of health, wellness, healing, and mindset have been giving us tips for a better and healthier life. My name is Moni C, your host and creative mindset coach, and today we have a very special guest. Her name is Tauna Young. She's a psychiatric nurse practitioner and anxiety and nervous system expert, also founder of Neurovana Calm. Tauna, thank you so much for being here with us today. I am so happy to have you here. Tell us a bit about yourself and what are you doing today to help people from around the world? The floor is yours.
Thank you, Moni C. Thanks for having me on your show. It's a pleasure to be here. I'm still a full-time practicing mental health provider doing psychiatry. So, I help 20, 25 people every day just in my office with their mental health. And in addition to that, I did start Neurovana Calm, which is something that hopefully will help people around the world because I'm limited on what I can do as far as the direct, one-to-one patient care here in my office. And this does give an opportunity for me to increase my contribution, I guess, to the mental health community, which is an honor and it's been one of the greatest pleasures of my life.
So you're the founder of Neurovana Calm. Tell us about it. What is it?
Yeah, so it's, CES, Cranial Electrotherapy Stimulation. It's just a little handheld device. It's got little wires on it that come out of it, look kind of like headphones, really. Just a little ear clips right here, little clips, clip them onto your ear. Then you don't even have to take your earrings off. You can just put it on in front or behind the earrings. Turn it on, and it's just a little tiny 9-volt battery in there, so it's just a little teeny tiny microcurrent. Sends a little tiny microcurrent in there, and the effects of that are it seems so minor, but the effects of that on your emotional state and your ability to experience calm are quite profound, quite impactful. The reason that I started it is because, I had been a mental health provider for 5.5 years before I learned about these. And I've helped thousands of people with anxiety and insomnia and many of the other conditions that this helps with. And I had never known about it. And that didn't make sense to me once I saw what the research indicated and then even saw it with my own eyes how much it helped my own patients. I didn't understand why it isn't more well known in the psychiatric community. So that is the mission, is to make this additional treatment option more well known and more accessible.
And so it mainly helps with all different forms of anxiety. And you mentioned also insomnia. How come? I just don't understand why I didn't know about it. Why people don't know about this?
I don't know that. I wish that I knew like, that was my question. I was like, why? Where have I been? Where have we been? I mean, they've had FDA clearance since 1979. So, like, I could have had these for my kids when they were little and they were anxious. I could have been offering it to my patients those first years of my career. So it's mind boggling. I mean, I think that part of it is the main focus has been on pharmaceuticals, which I have nothing against. I prescribe pharmaceuticals all day, every day. It's not the only thing in the toolbox, though.
Mm.
There are other things that have earned their place in that toolbox. This certainly has. In fact, it has outperformed SSRIs in its efficacy and safety. But most people just don't even know that it belongs in the toolbox.
And so everybody should really accompany any treatment that they're doing with this CES
Cranial electrotherapy stimulation.
yes, device that you
Uh-huh.
created and you are selling, correct? I mean, you do meditation, you do relaxation exercises. You can use it really at any time, in addition to any other modality, correct?
Absolutely, you can, because it's not a drug. So we don't need to have the talk about what meds you can combine it with, because it's not a med, it's not a drug. You cannot overdose on this. You can use it 24/7 if you want to. Most people aren't going to do that, but you could. There's no dangers to doing that. So the safety profile, it's just a really short conversation because there aren't any It's had FDA clearance since 1979, and part of that is to have a reporting process for adverse events. And there have never been any adverse events reported ever by any of the brands that have FDA clearance.
And so, what does the nervous system regulation? This helps regulate the nervous system, correct? The electrical current that emanates.
Yeah, I mean, that's one way of putting it, kind of a quick summary, nervous system regulation. The nervous system, the language of the nervous system is an electrical current. That is how information is passed in the nervous system. We call it an action potential, but that's what it is. It's, the exchange of sodium and potassium. It's ions across the membrane, like that's causing an electrical current. So we're speaking to it in the language, in its native tongue, so to speak, and giving it the current of calm. Now it does that by most of that electrical current. Like I said, it's very mild. It's not painful. In fact, you can have it so low you don't even feel it. But it's strategically applied to the ear is not just happenstance. Having it there, the nerves that it is impacting there, most of that message goes to the thalamus. And the thalamus is the primary relay station for the information that has come up from the rest of the body. And it's kind of like the interpreter of that. The thalamus regulates mood, emotion. It also regulates the sleep wake cycle, pain perception, like an aroused state or calm state. And so, when we talk in like natural health and wellness groups about like going to the root cause, this is as root cause as it gets, going straight to that misinterpretation of the data that's coming through. You could call it like a pacemaker for emotions.
That's a good way to put it. How long does it take? Everybody's different. I started using it and I already felt calmness. But of course, it depends on the person. You could feel the effects right away, or, of course, it's not a one time thing. I believe it's more, especially for people with CPTSD or chronic anxiety conditions, correct? How long does it take to see some results? You need to use it consistently for how many days or weeks?
Okay. So if we're talking about like just seeing benefits, a lot of people will feel benefits just within the first couple of minutes of putting it on. Not everybody, but I would say a majority people do. I mean, a lot of times people just in the first minute, they will be like, "Oh, wow. Yeah, my chest feels lighter." And people have said that even when they didn't even know what I was doing to them. Like they didn't have any, like I would put it on them and they didn't even know what I was doing and they would notice feeling more calm. Now, if we're talking, Moni, about someone trying to have long lasting results, what I usually recommend is I recommend that people use it twice a day, every day for a month, and then reassess. Because what this does, Moni, is it puts your brain into that calm state. It's in the same brain state that a person is in when they're meditating. Like on EEGs, the brain waves look the same as when you're meditating. And, brains are very habitual organs. And you don't just form a new habit just because you did it one time and liked it, right? So that's why I recommend a loading phase for that first month, because we want to first give your brain the current of calm, introduce it there, right? And then make it easier for it to go there. Train it to make that its new default. Make that your new default mode setting. And so that's what the benefits of doing it like twice a day, every day, like I said, for that first month is it's like we're teaching it to be familiar with it and be better at knowing how to go there. Because what we're supposed to do is when we're not involved in any outward task that's taking focus, we're supposed to be able to kind of downshift into a calm, relaxed state where we daydream, we remember, we process, we plan.
And for
But a
how
lot of
long?
people
How
don't.
many minutes? How many minutes? You say twice a day for a month. For
Oh
how
yeah.
long? 20
Um,
minutes? Half an hour?
I think at least 20 minutes would be ideal, although a lot of people, especially people with chronic PTSD, it can be a little emotional for people with that, and sometimes they just can't tolerate the experience of calm because it's been something that's been so inaccessible to them. So if you can tolerate 20 minutes, great. But if you can't, that's okay. You can work into it. Now this has settings on it so that it'll automatically Like, when you turn it on, you could set it to automatically go off after 30 minutes or 45 minutes, or you could just leave it on continuously. So I usually will recommend do a session, like do a 30-minute or 45 if you want to, and this will just go off automatically. People can use it 24/7, like I said, if they want to. But if you could do that twice a day, every day for a month, like, the benefits after that month of a person's ability to just be calm when it's appropriate to be calm are so impactful that it just blew my mind that it wasn't more well known. It works so well.
It's quite phenomenal. Now, you have sessions with your clients now online, and do you teach them to use this device, or your session is based on what? Can you walk us through one of your sessions?
Well, if we're talking about just meeting with me for mental health, I don't have a template for that.
Mm,
Like, I try to be very patient-centered, meaning it's I don't go into it with an agenda. We're gonna talk about the things that are important to you, meaning you if you were a patient. There is no one medical intervention that everybody needs, like, pacemakers work, but not everybody needs a pacemaker. CES works. There's no doubt about it. It works. That's not in question. There's not nobody like, it's not something that every single person needs, right?
mm,
But it's definitely effective, and so if I recommend it to somebody, which I frequently do, is because in psychiatry, so many people have anxiety, insomnia, depression, so many of the things that this helps with, that I recommend it to a large majority of my patients, and I have just a nice calm room here in my office where people can try it out. They can just come in and try it, or some because I see patients in person too, and they can try it just in, private and stuff and get their experience, but I also sometimes have them wear it during the session because sometimes we're talking about some really hard things, some really traumatic things, and I probably don't have to tell you that sometimes just talking about your trauma can be its own trauma, and your body will respond and, like, kind of react to just talking about it as if it was back there. And so what I've seen is we can put this on them and they can talk about it and tolerate the experience and the conversation way, way, way better than they would have been able to without it.
mm. That's incredible. And so, what do you wish that every patient and practitioner too, they all should have this device, um, for treating anxiety, insomnia, and as you said, during sessions, they can use it so that they can talk about their difficult
Yeah.
times. Every single one should have this device. The audience will find the information under our interview. There is a website where it can be purchased, this your device
Yes.
online.
Yep. You can go to neurovanacalm.com. So Neurovana is Neurovana for calm.com. You can go there. You can get it there. And also, Moni, for your audience, they can type in the code MONI,
Wow.
MOI, and they can get the prescription for free. That's a $20 fee for that, and we'll do that for them for free for your audience.
That's nice. That's beautiful. Well, Tona, I can't believe our time is up. What an incredible conversation. This is an incredible, to me, discovery. And the whole world should know about it, and get it, and try it because it really makes a huge difference in life, especially if you went through any type of trauma in the past, or if you have any type of anxiety condition. It could be mild, it could be more severe. But thank you so much for bringing your insights, your positive energy, your story, your expertise with us today. You're truly impacting lives in a very meaningful way. So I hope we'll see you again.
I
And
hope so.
until then, thank you very much and goodbye.
Thank you, Moni. Good to
Thank
see
you,
you.
Tana.
Bye-bye.
Thank you.